Dr. DaSilva-Ibru joins me now from Lagos. Welcome.
Thank you very much for having me, Aisha.
Dr. DaSilva-Ibru, I want to start with asking you about one case in particular. It's actually sadly one of several in recent times, which has galvanized this outpouring of public outrage on this issue of gender-based violence and the assault of women and girls. And I'm talking about the rape and murder of 22-year-old Uwa, who was assaulted and murdered in Benin City in southern Nigeria not too long ago. The head of Amnesty International Nigeria has been quoted as saying, what happened to Uwa really underscores that nowhere is safe for women and girls, not their homes, not their schools, not even churches. I wonder if you could put into your own words your sense of the threat faced by women and girls in Nigeria.
Well, with regards to gender-based violence, specifically in Nigeria, the statistics that we work with is 1 in 4 girls before the age of 18 would have experienced at least one sexual encounter. So if we're looking at our statistics through the lens of our population, we're 200 million people and 50% of us are women. And we're a relatively young country because we have about 64% of the population under the age of 24. So every day across all the different states in Nigeria, an average of over 10,000 girls are at risk of enduring a horrific sexual encounter. So when you look at it through the lens of those vast numbers, Uwa's case is sadly one of many. In her particular case, yes, it did go viral, and therefore there's a social outcry. But the issue of gender-based violence in Nigeria is one that's been prevalent for a very long time. And it's one that we need to address because I fear it's only going to get worse.
And I mean, just those numbers, you're giving 1 in 4 under the age of 18 having already been the victim of a sexual encounter, an unwanted sexual encounter is staggering in and of itself. And yet there's still a sense that we don't have a full grasp on the true picture here of the problem, the magnitude of this problem, and rooted in that is this whole culture of victim blaming and stigmatization. Talk to me about what continues to drive that, even though we know that there is a problem, the fact that this still persists, this culture that is silencing women and girls.
So like you rightly said, when we talk about our statistics, they're typically numbers that are conservative, because we never really have a true idea of the picture, because 54% of Nigeria is still in the rural communities. So when you take these sample sizes, you typically would take these sample sizes in more urban settings. The reason why it occurs, predominantly Nigeria is still very patriarchal in the approach towards women. And so women are typically subjugated, even if they aren't under threat of violence. We're dealing with an environment that's still steeped in a lot of traditional norms and cultural practices. And these practices, many of them are not encouraging towards empowering or protecting women in these situations, or women in general. And so you have that young girl or that young woman who's been raped. She's made to keep silent about the act, because globally the narrative is similar. It's usually somebody that's well known to her. It's usually a family member, and either in her home or somewhere that's well known. And so she's encouraged not to speak out about it because the family are more concerned with the hypocrisy of the family name, or they're more concerned with the shame that might be brought upon them if they reveal that one of their family members have been raped. So she's prevented from receiving the necessary services that she needs to be able to heal and get through this event. And this happens every day across communities, across different parts of Nigeria. You mentioned Uwa, who was sadly raped and murdered in the southern part of Nigeria. The very next day, we had a 12-year-old, Jennifer, up north who had been systematically raped by 11 men.
Mm-hmm.
And then a few days later, the western part of Nigeria, we had Barakat,
Mm-hmm.
another young lady who had sadly been raped and murdered. And so, as we know, rape and violence against women have typically no characteristics. There is no woman, an ideal woman that would be subject to rape or violence. It cuts across all geographical locations, age, race, color, as well as religious affiliations and educational status, as we know, because I was an undergrad, she was in Edo State, she was actually in church
Mm-hmm.
when this sad event happened.
Mm-hmm.
And then we have a young 12-year-old that was out of school, and then the same event happened to her in the very next day.
And so, talk to me about this outpouring, this moment that we're seeing. Hashtags we are tired, hashtags for Uwa, demanding justice for her. Does this moment feel different to you?
Absolutely, absolutely. I think what's happening now is not necessarily more cases, but certainly better reporting. And I think with the social media, there's been an outcry from women, you know, who are tired and saying enough is enough. They're tired of listening to the same stories and they're tired of the violence against them. I mean, they don't feel safe anywhere. I mean, we're talking about homes, we're talking about churches, we're talking about offices. I mean, no woman is meant to feel unsafe in every single environment that she lives in. And so this particular event that we're seeing play out is one that we haven't seen before. And so I'm very optimistic as a gender-based violence advocate working in the space. I'm hoping that it will continue. I'm hoping that after the newsreel, that the spotlight that we've put on the problem remains and that we can actually successfully tackle the issue and address this problem and hopefully start to eradicate the problem in Nigeria.
Dr. DaSilva-Ibru, I'm wondering, how do we go from making sure this isn't just a moment of outpouring, and actually translates into substantive, real change?
We need, as you rightly said, representation on a policy level, but then we also need collaborations and partnerships with all the different sectors. We need to all come together deliberately to see how we can assist. We need to be educated on ways in which we can move past just the awareness to actually being deliberate in our circles of influence, for instance. Parents need to be mindful of raising their children, making sure their boys are not entitled, making sure their girls are aware. Communities need to be mindful of not victim blaming, so women are enabled, so they can come out and speak their truth.
You're the founder of a not-for-profit called Women at Risk International Foundation that does incredibly important work around medical assistance for victims, helping with shelters. You have a hotline, you're doing training, sensitization, a host of things. With COVID and the lockdowns, I know there's been an increase in abuses, in cases. How are you able to support people right now?
I mean, at the foundation, in the very first 2 weeks of the lockdown, we had a 64% spike in the number of calls that we were receiving on our 24-hour confidential helpline. And 72% were from women asking for assistance. So the very first thing we had to do is we recognized that the WARIF Rape Crisis Center, which is one of the pillars that we work under and is located in the epicenter of Lagos, had to stay open. And so we had to ensure that our frontline workers were adequately equipped with personal protective equipment. We had to make sure that our 24-hour confidential helplines were actively manned. Our social media platforms, because we were receiving direct messaging from some survivors, as well as text messages. And so we had to ensure that all of these different safety responses were put in place. And in the rural areas, where we recognized that many of these women did not have access to our social media platforms and they couldn't get physically to the WARIF Center, we had to leverage off an existing initiative that we had implemented. We had trained 1,000 local midwives in many of the rural communities across the state. And these are women, mostly women, that are informally trained in healthcare provision, especially for expectant mothers. And so we had to then sit with them and explain to them that we needed them to go into their communities, literally door to door, to inquire as to the safety and the well-being of the women in their communities. Because these are women that were essentially trapped in their homes with their users. And where ordinarily you could probably call to inquire about their well-being, and say, for instance, with a confidential helpline, we would say to them, give us a buzzword to indicate whether you are at risk, for instance. Tell us, for instance, that you're doing well, or repeat after me. We'd give them a phrase to evaluate whether or not they were at risk. A woman in a rural setting didn't have a phone, so we could ring her and she couldn't call us. So this is where the traditional birth attendants would go in using obviously their they already had a relationship with many of the community leaders and many of the women resident in the community. So they were able to access these women in their homes and inquire about their well-being and identify cases as they occur, and they were able to refer the cases back to the WARIF Center. So we had to work almost simultaneously, addressing the needs in an urban setting, but recognizing that we also had to address the needs in the more rural areas.
What's your message to policymakers, to lawmakers, to the federal government, to those who have the ability to move the wheels of change? What do you want to say to them? What should they know?
To just effectively implement the laws that we have. Right now, we're spending a lot of time discussing, updating our laws. There's a lot of conversation about the punitive measures, whether or not life imprisonment, which presently, if you are found guilty of rape and you're successfully prosecuted, you would be sentenced for. There's a lot of conversation about the death penalty, whether we need stricter, more punitive measures. In my opinion, I think we just need to implement the laws that are existing now. Let's start seeing more convictions. Let's actually, increase our prosecution rate. That in itself will serve as a deterrent. You can't continuously address the issue by addressing how do we protect women, how do we treat women, how do we give them the assistance they need, and not address the accountability. Because then perpetrators will carry on with impunity, and that's what we're seeing.
Well, Dr. DaSilva-Ibru, you're doing incredible work. It's important, and we thank you for speaking to us today and just sharing your insights. Thank you so much.
Thank you very much for having me.